In this video, I want to help you understand how nitric oxide therapy can be a natural and effective way to reduce your risk for a heart attack. Hi, I'm Sid Milch, an 83-year-old Army veteran. I am also part of the Million Lives Project. Our goal is to help 1 million people or more understand how this Nobel Prize winning information can be a natural way to address most cardiovascular concerns. Now, to help you understand how nitric oxide therapy can be a natural way to reduce your risk for a heart attack, it is important to understand some key statistics. First, there are about 1.5 million heart attacks and strokes that occur each year in the United States. And according to the American Heart Association, if you survive your heart attack, then approximately 26% of women and 19% of men will die within 1 year. And the most common day of the week for a heart attack is on a Monday. And the most common time for a heart attack is during the morning hours between 4 a.m. to 10 a.m. when your blood platelets are stickier. Well, as I shared in one of my videos, one of the benefits of nitric oxide is that it keeps blood platelet cells from sticking together. This benefit naturally reduces both your risk for heart attack as well as your risk for a stroke. And when I Googled the question, what is the #1 cause of heart attacks, I got the following answer. Coronary heart disease, CHD, is the leading cause of heart attacks, and CHD is a condition in which the coronary arteries, the major blood vessels that supply the heart with blood, get clogged up with deposits of cholesterol. These deposits are called plaques. This process is called atherosclerosis, and as you can see by this slide, it narrows the inside of the artery to reduce blood flow and significantly increase your risk for a heart attack. It also causes a drastic reduction in nitric oxide production. Yet, when you nourish this lining of your cardiovascular system, what is called the endothelium, with the right ingredients, you can increase nitric oxide production. This nitric oxide then relaxes the smooth muscle of your vascular wall to dilate the blood vessel for improved blood flow. This then reduces your risk of a blood clot getting stuck in this narrow area. In my research for this video, I also found some current and encouraging studies in this area on how nitric oxide can naturally reduce your risk for a heart attack. Here is one from Science Daily that was published in the year 2018. Notice the title of the article, Heart Disease Severity May Depend on Nitric Oxide Levels. I've highlighted 2 lines in the summary. First, researchers showed the nitric oxide may help commonly used heart drugs maximize their benefits while improving heart function. This means nitric oxide not only benefits your heart function, but helps your medication work more effectively. Equally important is the second line, which states, in turn, the study found nitric oxide deficiencies could underlie heart failure while tilting drug effects toward more harmful pathways and side effects. This means the lack of nitric oxide production could set you up for heart failure and increase your probability of side effects from your medication. I also found this statement made by Dr. Jonathan Stamler, one of the leading authors of this study, to be an eye-opener. Our work shows that the main receptors in the heart that respond to drugs don't work without nitric oxide. To further echo this, I found this article from PubMed titled, Nitric Oxide and Myocardial Function in Heart Failure, Friend or Foe. Here is a direct statement from the lead authors of this study. Many diverse and often contradictory effects of NO or NO donors on myocardial function have been reported, which until recently have been difficult to make sense of. However, There is now an emerging consensus that NO generally acts to fine-tune and optimize cardiac pump function. And finally, I want to leave you with this quote from WebMD as it regards nitric oxide and heart function. In the body, the amino acid arginine changes into nitric oxide, NO. Nitric oxide is a powerful neurotransmitter that helps blood vessels relax and also improves circulation. Some evidence shows that arginine may help improve blood flow in the arteries of the heart. That may improve symptoms of clogged arteries, chest pain or angina, and coronary artery disease. As you can see, nitric oxide can help to significantly reduce your risk for a heart attack. And if you are on any type of heart medication, then nitric oxide can help that medication work more effectively. In my next video, I'm going to introduce you to 6 key ingredients that will help you optimize your nitric oxide production. Now, if you would like more information about the Million Lives Project and how we're helping our family and friends improve their cardiovascular health, then please click on the link below or call me directly at 810-347-2364 or send me an email at s.milch@comcast.net. Join me in this worthy mission. Together we can help our loved ones reclaim their good cardiovascular health.